My name is Andreas. I'm a medical student and I'm finishing my 5th year at the University of Copenhagen. Last year I wrote and defended my master thesis here at PERSIMUNE, and the project was an evaluation of causes of death in patients with a solid organ transplantation. So that's patients who received a heart or lung, liver, a kidney or a pancreas transplantation. And when a patient dies in a Danish hospital, a cause of death is registered, but it's usually not the doctor that actually has responsibility for the patient and that follows the patients that completes this cause of death form. So it's been shown that the cause of death for transplant recipients, who is a very complex group of patients, is usually not very reliable, and therefore my supervisor Nival, she did her PhD here at PERSIMUNE also, and she created this method to more reliably determine cause of death in organ transplant recipients. And so I have helped her collect data on cause of death in these transplant recipients and then evaluated the changes in specific causes of death seen over a 10-year period of time. Well, we saw a significant decrease in the risk of mortality for every cause during this 10-year period. So towards more recent years, the mortality is declining, which is very fortunate. And more specifically, we saw a decrease in the risk of death from infection and also death from rejection of the graft, the transplanted organ. And those are two very dominating and important causes of death in organ transplant recipients. So it's very fortunate that they are decreasing. Also, we saw an increase in the diversity of death causes towards more recent transplant years. I already defended my master thesis, and now I'm working on getting the paper published, and I'm still studying, but I'm also involved in other projects here at the PERSIMUNE. So I'm both studying and I'm fortunate enough to be able to be here and work on different projects as well. Well, I like as a medical student that there are many different fields of expertise, people with different fields of expertise here at PERSIMUNE. So I can ask, depending on my research question, I can ask bioinformaticians or statisticians or other or medical doctors, and that's very helpful. And also I think that the field of work with immunocompromised patients is just very interesting, and there's a lot of things to be done and to be researched upon in this field, and that's why I like working here.